How's it going, guys? Medium difficulty question for endocrine, steps 1 and 2. 42-year-old man, he's got a 6-month history, progressively worsening visual loss, left hip pain. Physical exam shows diminished peripheral vision bilaterally. So he's got bitemporal hemianopia. Clearly, we have a pituitary tumor here that's secreting a hormone. So we're not trying to obfuscate that. And x-ray of the hip shows a contracted femoral head. This is extremely buzzy, this word contracted, for avascular necrosis of the femoral head. So we've got a pituitary hormone that's causing avascular necrosis of the femoral head. Okay, could go on a long digression right now about things. For example, in pediatrics, if they give you a contracted femoral head, that would be Legg-Calvé-Perthes disease. If they give you sickle cell with a contracted femoral head, that's avascular necrosis secondary to OMG, sickle cell. Could even be stuff like Gaucher, but it's this word you got to know, okay? He's experienced 10-pound weight gain during this period, unusual for cancer, right? Usually weight loss, but we got weight gain. So what's most likely responsible? Choice A, ACTH, correct answer. This is Cushing disease. Now, this is what NBME is going to do. Not every question you get is going to be the hyper buzzy buffalo hump, moon facies, purple striae, central obesity, peripheral wasting. They don't have to mention these classic findings of Cushing's. Now here we have weight gain. What does ACTH do, right? It's secreted by the anterior pituitary, and it's going to cause the zona fasciculata of the adrenal cortex to make cortisol. That's its primary function, okay? So cortisol can not only cause weight gain, it can cause avascular necrosis of the femoral head. For instance, exogenous glucocorticoid use, very high yield cause of avascular necrosis of the femoral head. Okay, so patients, let's say, who have an autoimmune disease, rheumatoid arthritis, IBD, sarcoidosis, etc., who take chronic glucocorticoids, you got to worry about things like avascular necrosis. So you can get a nearly identical question rather than saying that you have a contracted femoral head or left hip pain. We could say there's compression fractures. That shows up in the NBME. Compression fractures are synonymous with osteoporosis. And just to be crystal clear, I mean, we don't give a female who's older just for the sake of it, right? We're not going to do that, cause confusion, but you know, they can give you a 42-year-old dude who's got compression fractures of the vertebrae, and that's osteoporosis. Answer ACTH, same exact thing. Okay, so very, very buzzy for USMLE. Okay, vascular necrosis, osteoporosis. So some students, let's just hop through the other ones. So choice B, growth hormone, wrong fucking answer. I mean, that's going to be acromegaly. So changes in facial structure can be joint pain, okay, because you get misalignment of the joints, hypertension, cardiomegaly, diabetes, growth hormone causes insulin resistance, wrong fucking answer. Choice C, luteinizing hormone, wrong fucking answer. So I've seen students choose this on the NBME question that gives you compression fractures for some reason. And it really is funneled down to the fact that students just don't know what LH does. It's a passive hormone. So I'm asking you, watch this clip. What does LH do? Okay. LH acts on, in men, the Leydig cells to produce androgens, and in women, females, the theca interna cells of the ovaries to make androgens. That's all LH does. Okay, so just produces androgens. Wrong fucking answer. Choice D, prolactin, wrong fucking answer. So prolactin in men, impotence, can cause galactorrhea. Okay, so milky discharge from the nipples bilaterally. It notably does not cause gynecomastia. That's a high yield point. Okay, so I've seen other questions where a patient with gynecomastia and student chooses prolactin. It's wrong. It's estrogen effect. Okay, long discussion of stuff. Prolactin in women can cause amenorrhea. And of course, prolactinoma, high yield treatment for USMLE is going to be bromocriptine. So it's a D2 agonist. Dopamine inhibits prolactin. There's other D2 agonists, pergolide, ropinirole, pramipexole, but bromocriptine just tends to be the one that's used for prolactinoma. Choice D, wrong fucking answer. Choice C, TSH, wrong fucking answer. So TSH, now if you had a TSH secreting tumor, you'd have hyperthyroidism, you'd have weight loss, not weight gain. So just that detail in and of itself tells you that it's wrong. Okay, so not necessarily related to avascular necrosis of the femoral head, but in the question that I've talked about already, where you can get compression fractures, I've had some students say, oh, well, can't thyroid hormone technically lead to osteoporosis? It's like, maybe, but even if we wanted to make that contention, you still wouldn't have weight gain if you had a TSH secreting tumor, you'd have weight loss, right? You're going to get weight gain with hypothyroidism, not hyperthyroidism. I've never seen USMLE, any NBME question, assess this notion of osteoporosis secondary to hyperthyroidism, even though it's a theoretical. TSH, wrong fucking answer. You know the deal in 2 make more content on my subscription. Appreciate your time. That's it.